Dr. Leigh, there's about 30 million people out there in America, apparently, who wear dentures. And most of them are complaining. An uncomfortable thing. Just the thought of it makes me look older than I am, you know. So I can see that because we have grandma in our mind, you know, with her little thing and caved-in face and all that stuff. And, of course, not being able to really eat proper, to laugh, because always worried about it's falling out. It might not fall out, but one is, you know, when it's a little bit wobbly, one worries. And and never mind the glue which they keep putting in to hold it. I mean, just couldn't be comfortable. There's this new thing out there, and I call it a hybrid denture, but whatever you doctors call it, it's an implant-supported denture. Tell us about it and tell us the advantages. Is it really a sliced bread kind of like? Is it really like that enormously of an advance?
It's a huge advance. It's a denture that is supported by two posts, which is what we call implants, and it basically keeps that denture from moving, so that denture wearers can chew their food with confidence, not worry about them falling out, not have to wear adhesive. They don't have to get those annoying sore spots. The dentures sometimes, or most times, are smaller than they would normally be. So again, you're able to taste your food. You're able to chew your food. It's a major improvement in anyone's quality of life who wears a denture.
So how does that work? Because, you know, in most cases, I would assume, I might be wrong, and you tell me, if a person has lost his teeth, let's not worry at this moment or all the stuff he should do not to lose them. We mentioned it in periodontal disease surgery and all that stuff. And, you know, fine, it's gone, they're gone, or most of them. So you have an option. You put a tremendous amount of implants in it, which is expensive. You know, 8, 10, 12, whatever I don't know, but lots of them, right? Very expensive. Or you put dentures in it, quite inexpensive, really. And but you now suffer that, number one, you're never sure whether they fall out. You feel uncomfortable. They're not fitting so well. You get food stuck underneath. It hurts. You can even not taste the food because apparently the palate is covered with a metal or a plastic roof in order to suck. Kind of, it's used as a suction. So you have all that stuff happening, and it's a money thing. So when you do an implant-supported denture, how many implants you more or less put in it? Like I've heard as little as 2, 3, and sometimes a few more. Apparently it gets better as more as you put in. Makes sense. I mean, that's why we have... that's why we get little training wheels on a bicycle when we're kids, right? Because 2 fall over a little faster than you get 3 or 4. That's a lot better. So the price versus an implant versus a lots of implants, and this must be hugely different. But how is it? If I have such an implant-supported denture, can I chew on a spare rib on 4th of July? Can I bite into an apple? Yes or no?
Yes, and yes. You can bite into an apple, you can chew on a spare rib, you can eat pretty much whatever you want. And generally, we place a minimum of 2 implants to support a denture. Okay. I give patients the option. We can start with 2, and if they feel that they want it more secure, we can place more later. So if you do 2, you're not locked into 2. You can always add a few more.
So if finances is a problem, get 2 and then build on it, and put another 1 or 2 in it a year later in order to stabilize it even more.
Exactly, and the more implants you place, the smaller the denture is. So that's an added benefit too. We can actually shrink the size of the denture the more implants we place.
What do you mean by shrinking the size of the denture? What do you mean by that? I mean, it needs to cover all the teeth. I mean, what are you? You're putting only 2 rabbit teeth in it when it gets smaller. What are you talking about?
Well, just to simplify it, you have on the denture you have teeth. And then you have the pink portion, which is the plastic that rests on the gum tissue. Yeah. So the more implants you have, the less pink portion of the denture that needs to rest on the tissue, or the less tissue you need to support the denture. So we can cut away the pink part of the denture. So in that way we can make it smaller.
And so that would contribute to you tasting the food better.
Absolutely, yes, because it exposes your palate and the taste buds that are in your palate.
Right. Wow. So let me ask you, a person who has dentures, and he says, I'm sick and tired of putting cream in it and whatever it is, and anyway, they're not fitting. I need to go implant-supported dentures now. I want to upgrade. Can he use his old dentures, or do they not qualify for being transformed into implant dentures?
It depends. Sometimes we try. I mean, we understand that is an expense, and if we can use the existing denture, we will. If it's an old denture, if the denture's 30 years old and the teeth are completely flattened, then you need a new denture. But it depends on how new the denture is and the condition of the denture.
I got it.
And if we do use that existing denture, the patient knows that it may not hold up, and they may have to get a new denture in the future. So they understand.
I got it.
And we're willing to try.
And of course, once you have the implant in it, let's just say you use the old denture because you want to save that money at that moment, and that's kind of okay. Mm-hmm. But at the same time, like with a car, you say in a couple, 2-3 years, I would like to upgrade. I would like to make them better looking, because obviously a denture, if it's it has a lot to do with look. You can make it the way wide teeth, small teeth, long teeth, short teeth. You can adjust it to a person's face, right? And
yes.
Most likely the guy who made the denture in the first place did that already, but as you said, they wear out, we can walk it. So anyway, if you use the old denture, and if you can use it because it's clinically still doable, fundamentally strong, and then a couple of years later the guy says, now it's time for a new one, I want a little different look. You don't need to redo the implants anymore, right? You just do that now.
No.
Good. Beautiful.
Yep. Mm-hmm. Yes.
Well, all right. Anything else we need to know about dentures? Implant-supported dentures.
I just encourage anyone who's wearing a denture, if they're not happy with it, visit us. We'll do a consultation. I'll take a look, and we can go over your options.
Right. And let me ask you one more question. If you have an implant-supported denture, do you still need denture cream and adhesives or whatever?
No.
That must be, that in itself.
You can throw it all away.
That must in itself be like a world of difference. And as I said, I almost thank God that I, didn't have to use it. And technology now is that I never will have to use it. All right.
Exactly.
Thank you very much, Dr. Leigh.
Okay, thanks.